Hi, I'm Dr. Mina from Vinci Dental Clinic. I will take a few minutes to explain the procedure of endodontics and root canal treatment. The system that we are using is really, in my opinion, one of the most efficient, effective, and fastest way to resolve a root canal problem. So, just as a small comment, when you have a problem with your nerve of the tooth, with the canal of the tooth or the pulp chamber, that means that we have an infection or a problem really with the nerve. We have to remove the nerve, shape the canal, and then obviously fill it correctly from top to bottom. This is the most important challenge, to really clean as much as we can. We are trying always to clean 100% of the canal space of the endodontic system. It's really a challenge, but I know that this system is really doing the most for this effect. So the way we start, first of all, we have to diagnose the tooth with the problem. When we find the tooth, we have to isolate it from the rest of the mouth. So we are always using a rubber dam. This is the rubber dam. The rubber dam is really quite a simple system. It's a piece of rubber that firmly goes around one or two or a group of teeth that needs to be treated. It has this special clamp that can widen with the clamp, and we can put through this the tooth that is intended to be treated. As a quick demonstration, it will look something like this in the mouth. Okay, so we can have one tooth that is isolated completely from the rest of the teeth. That means that when we are washing the tooth out with special solutions, or the patient is swallowing, our solutions will not go down uncomfortably, or the saliva from the mouth containing bacteria will not enter the tooth. So we are protected. After we open the tooth, we make a hole in it, and we enter the canal. We have to really know in what kind of space we are. So first of all, we have to measure the size of the tooth, like I said, from top to bottom. For this, we use this small apparatus. It's called an apex finder, and it helps us find the apex. The apex is this area of the tooth, it's the tip of the tooth, and it's really difficult to see it or to feel it because it's underneath the bone and we can't have a direct look at it. By using this, it's really like a parktronic. For cars, is the parktronic for nerves. So when we go into the canal with our special files, we are in real time able to see ourselves where we are placed in the tooth. By connecting this to the lip or to the mouth of the patient, and this to the file that we are using, as we progress into the canal, we will also see here the little illustration of where we are in the tooth. So it's really comfortable to work and to know where we are at the same time. That's step one, to know where we are and how long the tooth is. So after we are into the canal, we do a quick measurement, and we can know that the tooth has, for example, from our point of reference, 22, 23, 24 millimeters. We note this, and we know that that's our working length. Step two is to shape the canal. Now we know that we have, I'll give you an example, 22 millimeters, we need to give a perfect shape. For this, we're using the most closed system. It has one file. It's a one-purpose file. This is a pack of 6. They are super easy to use, and it's very hygienic for the patient. It's one-time use. They are sterile. We don't reuse them. So it's one time, one patient. That's a good comfort knowing that we are protected. So by using one of these files, we have this machine that gives us the rotating movement. It's an automatic machine, and the system is called reciproc. It's using one file again. We have three different diameters of the files. So according to how wide the tooth is or the canal is, we can choose the right file for the job. Let's say we are using 25. We are using file 25. So we put the file on the machine and we enter the canal until we reach our working length. And occasionally we stop to clean the canal. When the working length has been reached of 22 millimeters for our example today, we stop, and then it's all pre-calibrated. So we're using the R25 file, and then we have sterile R25 paper cones. These are used to dry the canal and to make sure that everything is correct and we have no surprise bleeding inside the canal. After we dry the canal properly and measure again, we are using pre-calibrated again R25 Gutta Fusion. There are some Gutta Perca cones, and these are again all calibrated, so we cannot make any errors. And to use these, we have a small plugger, a small measurer here. We measure the distance of 22 millimeters and apply this Gutta Perca Fusion rod into this machine. There's a small, like it's a small oven that warms the Gutta Perca to, I think, about 200 degrees Celsius inside this machine. It goes in, and then when it's ready, it comes out. We have this hot Gutta Perca that is ready to go into the canal, and we proceed to fill the canal with this Gutta Perca. It's a really simple procedure and very accurate. Follow-up x-rays always demonstrate that we are doing the proper job, most of the time in one session, so it does not require follow-up visits. That's very important to save time and to know that your trouble has been resolved at once. We don't like to be on this chair, so as long as we can do it faster, it's a pleasure. I'm glad to present for you this system, and hope it's useful. Thank you.
Thank you very much, Dr. Mina.